Few patients ever get the chance to personally thank their doctor who saved them from an acute cardiac crisis. Jeff Rea, you know him as the former mayor of Mishawaka and current CEO of the South Bend Chamber of Commerce, survived a type of heart attack that kills half of those who have them.
I don't even almost know how to describe it, because like my whole life, you get pain from different things. This is really different. And so I went very quickly from I might have overdone it to something more serious is wrong. But I also was very alert.
Jeff's interventional cardiologist at Beacon Medical Group, Dr. Muhammad Aslam, says his left anterior descending, or LAD artery, was 100% blocked. It's the main artery that supplies blood to the left ventricle, which then pumps blood to other areas of the heart.
So that's where we have to open up the artery right away, because the longer we wait to open the artery, more damage the heart is going to be.
Dr. Aslam says to always call 911 if you feel like something's off. Ambulances are equipped with EKGs so they can give doctors a better picture even before you arrive.
For the time the patient gets to the ER, from the time the artery is open, should be less than 90 minutes.
In Jeff's case, he says he was riding his exercise bike moments before his heart attack in March of 2025. He was 55 at the time, relatively healthy, and stayed on top of his numbers because of his family's history with heart attacks.
Thought maybe I'd overdone it, but knew something felt very different than I'd ever felt before. Decided I better go get that checked out.
He and his wife went straight to Beacon. A specialized heart team known as a STEMI team was activated to begin reopening the artery.
They all have to be in the hospital within 30 minutes. If it's daytime, we're all there. Nighttime, you have to be in the hospital within 30 minutes. And during that time, they're getting labs done, patients are getting labs done, they're getting some blood thinner medication, they're getting aspirin, they're getting pain medication.
Dr. Aslam says they ballooned open Jeff's artery and had to remove the clot so they could see where to place the stent. They went through his wrist through a minimally invasive procedure.
So every time the heart pumps, it pumps about 60 to 65% blood out. In this case, his heart, right after the heart attack, was pumping about 35%.
Although Jeff's artery was back open, his recovery wasn't over. He began medications to strengthen his heart and blood thinners to prevent the stent from closing during healing. He went through cardiac rehabilitation at Memorial Hospital, has new medication to prevent a future heart attack, and gets routine heart scans to assess his heart function. The whole time, Jeff says he was surprised to have had such a serious heart attack, but adds he's lucky because his wife could have become a widow that day.
I have a different sense of urgency probably too. I almost wasn't here, and so I got a second chance at things.
Thanks for watching. Like and subscribe to the WSBT 22 YouTube channel.